Hi again. Today we're going to be continuing our vitamin C lecture. So we're going to be doing part two, which is basically kind of looking at what vitamin C is popular for. So, do any of those supplementation regimens work to help lower, cold incidence or cancer, that type of thing. So, before we jump into this, I just want to do a quick mini review. So, what's the role of vitamin C in hydroxylation reactions? So, remember that's when you basically replace a hydrogen with a hydroxyl group, the OH group. So, what is it doing in that? Is vitamin C actually like moving or placing the hydroxyl group on there? Nope. It's pretty much just donating electrons to a cofactor of an enzyme. And then number two, what does vitamin C do as an antioxidant? What does it do to free radicals? Yeah, same thing. Pretty much just donates electrons. So just keep in mind the only thing vitamin C does pretty much is donate electrons. No matter what it's doing, its job pretty much always involves just directly donating electrons to some compound that needs them. How is vitamin C regenerated? So, what's the name of that compound that regenerates vitamin C? It's glutathione. So, I think we did that at the very last slide in the last lecture. All right, so we went through kind of vitamin C's roles in building things, so hydroxylation reactions, making collagen, carnitine, tyrosine, and norepinephrine. And then we also looked at its antioxidant role, which you probably knew about before even taking this class. Today we're going to move on to something that's kind of a little confusing, the pro-oxidant role of vitamin C. So we definitely all know that vitamin C is good at being an antioxidant, and honestly, that's mainly what it does. But there's very rare circumstances where vitamin C can also act kind of in the opposite way as a pro-oxidant. So let me just kind of show you this. I find pictures always kind of work better to teach people things. So remember vitamin C, here's the ascorbate. It is helping to reduce iron here. However, in very, very rare occasions when it reduces iron, and remember this occurs with like a lot of those hydroxylation reactions, that reduced iron, so the Fe2 plus, can go on and react with hydrogen peroxide and then later become a hydroxyl radical. So, this very kind of potent reactive oxygen species. So this is a little confusing to people because we all know that, usually vitamin C is super protective, but in this very, very rare occasion, it can actually do the opposite effect. One thing to keep in mind, though, is that this pretty much never happens, and that's because iron would need to be in its free form to react with vitamin C. But as we'll learn later on, iron is pretty much always attached to something. It's always attached to some protein transporter, basically, in the cell, out of the cell. It's never left by itself. And the reason for that is because iron is highly reactive. And the minute it's not attached to a protein, you'll basically get like this type of reaction where it can react with usually hydrogen peroxide to become some type of potent free radical. So again, this very rarely happens because iron's almost always bound to proteins. But it has been shown to happen when people kind of go crazy and are taking those super high doses of vitamin C. So, what was the RDA for vitamin C? Do you remember what that range was? It was 75 to 90 milligrams. So we're talking 12,000 milligrams here. That's like, you really need to, if a lot of those pills are, most of them are like, sometimes it's 1,000, but most of the times it's 500. So you need to take 24 supplements a day to kind of get into this range where vitamin C could act as a pro-oxidant. But, some people do that. So if you have any clients as a dietitian that are taking insane amounts of vitamin C, you should definitely let them know about this kind of negative effect of that. So let's move on to the research on whether or not vitamin C works to treat the common cold. So, a bit of background: the common cold, as you all know, is an upper respiratory tract infection, and most of them last about 10 days, so about a week and a half for most people. And it's caused most commonly by the rhinovirus. And the average person gets 2 to 6 colds per year. So I found that when I kind of dove into the research, most of it's broken down into two separate sections. So prophylaxis, kind of fancy word for prevention of colds, and then treatment. So prevention is like if you're just regularly taking it, are you basically less likely to get a cold if you just take vitamin C every day? And treatment, for the most part, is do you, if you like take it on day one of feeling like you're getting a cold, can you like shorten that or just prevent the cold entirely from happening? So, what I noticed first looking at all these slides are first preventing colds, so the prophylaxis studies. Interestingly, for the prevention studies, all the studies were broken down into either athletes or non-athletes. So non-athletes obviously being kind of the general public, but athletes meant like real athletes from what I could tell. So a lot of these people were like training for the Olympics. They were triathletes, people like training for marathons, where people are doing a considerable amount of like training, like hours per day, most days of the week. So, what I found was that in the general public, so in non athletes, first of all, I looked at this meta analysis of 30 placebo controlled trials. So, I think most of you have taken the research methods class at this point. But what is a meta analysis? And for those of you that haven't, I'll explain it in a second. So, a meta analysis is when you combine the results of a bunch of different studies. But by combining the results, I mean like you literally need to call up the researchers and ask them for their like Excel spreadsheets of all their data. You take all these 30 people, send you all their data, you have to kind of throw it into one big spreadsheet and then like make your own like mega study out of it pretty much. So that's what these people did. And they noticed that in the studies where people were asked to take 1,000 milligrams per day, so like two of those supplements, two of those caplets or capsules of vitamin C for 4 months, there was no effect. So taking 1,000 milligrams, two of those a day for 4 months, did not prevent colds. They pretty much got colds the same amount as people that didn't supplement and just consumed the normal RDA values. And then they also noticed that if you're taking 200 milligrams per day, so I guess maybe there were studies where they gave them a supplement with 200 milligrams per day. I actually haven't seen like capsules at that level. For 3 months, there was no effect. So really, kind of the take-home message here is in the general public, people that are just regularly taking vitamin C will not have a lower chance of getting colds than somebody that wasn't taking those supplements. Now, looking at in athletes, a little different here. So there was 5 studies that looked at vitamin C supplementation in runners and skiers, and they were taking 200 milligrams per day for 3 months. And they did find in this group of athletes, interestingly, their incidence of colds decreased by 40 to 90%. So in athletes, for some reason, it does seem to work if they're supplementing, again, which is a low dose. This is just like two times the RDA roughly. They can actually decrease. And they weren't sure why that differed from the general public, but for some reason, vitamin C can help prevent colds in athletes, like people training for the Olympics. Now, looking at whether or not it can treat colds. So these studies were basically, will the cold go away faster kind of thing, or will it just not happen at all? So people who regularly take vitamin C supplements, again, so 500 milligrams a day or so, they did find that in those people, the duration of the cold was a little bit less. So, most people, a cold will last 10 days. In these people, their cold, I think, lasted on average like 8 days. But they did have to take these supplements all year round, every day. And basically, they still got the cold. So it's not going to, in the general public, you're still going to get the cold, but it might be a couple days less. So I don't know if If you really hate getting colds, then sure. And if you don't mind taking vitamin C every day to lower your cold's duration by 2 days, then, that's really up to you. But it's not, I know that there's like all these products like Emergency and I think Airborne as well, like all these different things, like saying that you can basically like stop yourself from getting a cold if you take these. Those are just, it's completely false. You can maybe, if you take it, I guess, like every single day, lower the duration by a few days, but that's pretty much it. They're not going to prevent you from getting a cold. So, yeah, it is a little confusing because I know there's like different data for athletes and non-athletes, but basically, I guess it works a little bit, but not really. One thing to point out though that they found with all of these, like Emergency and all these products, there has never been a study to show that if you take these products on the first day of getting a cold, so you kind of sense a cold coming on, and all of a sudden you like drink some of this Emergency or whatever it is, that has no effect. So it seems like you have to kind of build up a level of vitamin C in your body for it to lower that duration. But if you just take it on the day of a cold, it's not going to have an effect. The mechanism of action is not really clear of how it kind of lowers the duration. Vitamin C may enhance immune function, increases the cytotoxicity of macrophages, or it may increase the synthesis of certain immune cells. There have been some in vitro studies showing that, but the jury's out. We're not quite sure how it's doing that. So yeah, so that's what we kind of found for colds. Works on average, if you're an athlete, it might work, but the general public, the only thing you're really going to see is kind of a mild decrease in the duration of your cold if you take vitamin C every day. Okay, so on to another thing that vitamin C is marketed for. I don't know if you've had a chance to kind of go to Walgreens or anything and check out that whole or aisles, I should say, of different vitamins and minerals. But there are a fair amount of vitamin C supplements marketed for cancer prevention, and hopefully not treatment, but I think mainly cancer prevention. So before I get into the data, I just want to go over the basic cancer mechanisms. And then your pathophysiology class, I think you take it right now too. So I'll do, again, it's too bad. I guess I'll talk to you during the live Q&A to ask when you're taking these classes, because I never know how much detail to go into with the background of certain diseases. So just remember that you probably learned this too in physiology. Cancer initiation is basically free radical damage to DNA. So we went over this last lecture, unpaired electron. It wants to have a paired electron, so it'll steal that second electron from DNA. When it does that, you basically kind of mess up DNA itself, and then that can lead to a copying error. And then just in general, that's what a mutation is. So one thing I do want to point out though, when I learned, and you probably did too, like since high school, that you can kind of damage your DNA with free radicals, and I always thought like, oh, I guess that doesn't happen that much. So I actually looked it up, and it turns out that DNA damage is like super frequent actually. Our body experiences 800 DNA damages per hour. So even like during this lecture, your DNA will have been damaged 800 times while just sitting and listening to this vitamin C lecture. The reason that we don't get cancer, though, is because we have all of these repair enzymes. Basically, most DNA damage is removed by these enzymes pretty quickly. So the second it's kind of damaged, these enzymes kind of jump in and like clean it up and get rid of it. But the repair process is not 100% efficient. And so if it kind of makes a mistake, if the damage is not repaired, that's when cancer can develop. And then just to remind you too of the different stages of cancer. So first you start out with that cell with a genetic mutation. Then that goes on to kind of the next stage of cancer, which is hyperplasia. That's the proliferative increase in the number of cells. So it's mainly just numbers increasing. Dysplasia is the next stage when you have a change in the actual phenotype of the cells. So size and shape changes occur. And then the next stage of that is kind of full blown cancer. But first, it's in situ, which basically means it stays in place. And then the next one is the metastatic or invasive cancer, when that kind of breaks off and goes into the lymph or into the blood vessels, and those cells kind of travel around the body and take up residence in different, like in other organs. So, how exactly does cancer? What are the mechanisms of how vitamin C can decrease cancer risk? Well, the first obvious one is free radical neutralization. So, obviously, if vitamin C is donating those electrons to the free radical, it will then not go on to steal from a DNA, and then so that whole process of cancer initiation will be inhibited. The other one, which is kind of cooler, is vitamin C kind of participates in this cool kind of walling off of tumors. So remember, vitamin C plays a really crucial role in collagen formation, and proper collagen formation is really important for tumor encapsulation. So what happens is when cancer develops, the body's actually smart enough to say like, oh well, this is bad, but we don't want it breaking off and like moving to other places in the body. So the body will form this kind of like thick layer of collagen around it to literally form a wall around that in situ cancer. And so, if you have proper vitamin C levels in your body, you can actively make this collagen barrier, and then that can slow any metastasis, like any metastasis. So, is vitamin C actually effective for preventing cancer? So, kind of by the end of this lecture, I just want to go through like whether or not you should be as a dietitian, like advising people to take certain supplements for certain diseases. So I'll kind of show you the research and then I'll give you a general conclusion about it. The two major areas I found most of the research in was breast cancer and prostate cancer. So obviously these are two major cancers that affect both men and women. And I'm pretty sure most of you have actually taken the research methods class. I know it's also offered this semester. So, just in case you're not, I'll go through a little bit of background on study designs and stuff like that so people aren't totally lost. So, this first study was a prospective cohort study. And what that means, again, I always like to show things in pictures, is you take a big group of people. So in this one, they took about 350,000 people. And then they follow them. So prospective cohort is you take a cohort of people, so a group of people, follow them for a certain amount of years. In this case, they followed them for almost 10 years, so 9 years. And then basically what you do is you're just waiting to see who develops the disease of interest. So this was specifically a cancer study, so they looked at breast cancer as well. They found that 7,500 of these postmenopausal women developed breast cancer, and then the rest had no disease. And then what they do is at the same time, so every year they collect a food frequency questionnaire, so once a year, and then they kind of just look back and then they try to say like, well, was there any differences in the amount of vitamin C or whatever nutrient of interest between these two groups? And so what they found was that there was no association with vitamin C supplementation or vitamin C from diet and breast cancer rates. So it didn't matter if you were consuming like almost no vitamin C or like tons of vitamin C. It was not at all related to risk of breast cancer. The Women's Health Initiative also studied this. So this is a really big study in the US that you might have heard of in other classes at this point. It was completed, I think it's still kind of going on, but I know that it was completed, I think, or a lot of the data was released, about 10 years ago or so. And it was, again, kind of the same as the other one, a prospective cohort study. This time it was 85,000 postmenopausal women that did not have cancer at baseline. They followed them for 8 years and noticed that about 3,000 of those 85 developed breast cancer. And then again, they gave the food frequency questionnaires every 12 months, and then they tried to run some kind of correlations between the amount of vitamin C you're taking in. So if you're getting enough or not too much or like tons, and whether or not that affected breast cancer rate. And they found basically no associations with that. I do have to say the food frequency questionnaires, they're not great. Like I know that they're useful in this kind of survey studies, but it's they don't really give an accurate portrayal of what people are actually eating, because a lot of times they say like, oh, how many fruits and vegetables do you consume over the past like 6 months or something like that. Like it's just far too generalized, I think, to kind of capture like a real yeah, just to really see what the person was eating. And then, so the last breast cancer study to look at was a case control study. So that's kind of backwards from the other one. This is when you start with people with breast cancer. So women with breast cancer, about 400. And then you find match controls. So people that did not have breast cancer, but were very similar. So overall, these two groups would have the same like BMI, maybe history of breast cancer, age, that type of thing. So you want to match them to a control group. And then you just look back retrospectively and you take a food frequency questionnaire and you say like, well, how much of this and that did you consume over the past year or so, which again is a pretty major flaw in these studies, because it's like I can't even remember what I had last week, let alone like to eat, let alone like what I had last, whatever, like a year ago. It just seems a little far-fetched. But what they found though was that, and then you compare it. So you look at the breast cancer cases, and here they categorize them into two groups: women that consumed kind of above the RDA, and then women that consumed kind of around or below the RDA. And same with the controls. And they found, interestingly, this one was kind of an outlier study, but they found that women that consumed kind of higher than what you're supposed to like kind of a bit too much vitamin C, were actually, they had 2 times higher rate of breast cancer. And then this was an observation that was noted. This is from supplements and from diet. So it wasn't just, it's actually not that hard. Remember, orange juice, it was what, like 125 milligrams per cup or something. So I know these, I'm always surprised by these data, but there, yeah, again, you have to look at, if we look at everything together, the two prospective cohorts, which are kind of more powerful research designs, found no association with vitamin C and breast cancer, whereas the only one that did was that kind of smaller case control that found if you consume more than 100 milligrams per day of vitamin C, that might actually increase your breast cancer rate. So I'd say, the data is definitely inconclusive, but at this stage, if you have a female client that wants to decrease her risk of breast cancer with vitamin C supplementations, I'd probably tell her not to do it. There's just not enough convincing evidence to show that that actually works. So reasons for conflicting data. So why did one show a negative effect and the other one showed nothing? Well, vitamin C intake is pretty highly correlated to your lifestyle, right? You're going to have higher intakes of vitamin C if you're more likely to consume fruits and vegetables, that type of thing. Also, cancer studies with diet are so tricky because, oftentimes they'll just look, back at maybe like past 10 years of food intake. But who knows? Like it might actually be what you were consuming as a baby or as a child. Maybe that's what influenced your risk of developing cancer in later years. And as I mentioned before, FFQ food frequency questionnaires are really weak measures of dietary intake. So it's tricky. The hardest thing in nutrition research is we just don't have a good measure of food intake. Like it's the main thing we need to measure, but I think that's why nutrition research flip-flops around so much. One year we say coffee's good for you, the next year we say it's bad for you. Cholesterol's good, cholesterol's bad. I think it's just hard because we don't have an accurate measure of what people are eating. So it's hard to kind of formulate really like strong conclusions about anything. Another thing in these studies, it's always good to measure plasma levels of ascorbate. So you can kind of see if people are eating enough vitamin C. It's kind of like you don't have to rely on their dietary the diet recalls or food frequency questionnaires. You can actually just see if their body stores are adequate. So that's one thing that would be interesting to look at in future research. So now looking at the prostate cancer studies, so just a few of these. These were kind of, like similar designs. So this one that was done in Italy is a case control study where basically they took a group of men with prostate cancer, compared them to a control group, and then looked back over what they were eating for the past 5 years. And they found no relationship with vitamin C intake and prostate cancer risk. And that was from the supplements were not assessed in the study. So that's definitely a major limitation. The next one, the prostate cancer screening trial. This was one of those kind of more powerful studies, a prospective cohort study. And they found in this one the same thing, no relationship with vitamin C intake and prostate cancer risk over 8 years. Probably one of the most powerful studies to date, because it was a clinical trial, was the Physicians Health Study. This one actually assessed the effect of vitamin C and also combined with vitamin E on all these different kind of rates of disease or disease risk. So they looked at cancers, but they also looked at like heart disease and stuff like that. It was done for 10 years, and they actually provided almost 15,000 men over the age of 50 with these supplements. So the way that they did this was they actually like mailed them once a month, kind of like a calendar blister pack, like kind of like an advent calendar of like these different vitamins, and then the people had to like mail back the packets to show that they consume them. But people lie all the time. I do like intermittent fasting research, and we try to feed people, but we send them with these bags of food, but I don't know if they're just like dropping that in the garbage the second they leave our center, but who knows. Anyway, so that's kind of how they perform the study. So yeah, again, about 15,000 people, about 3,600 per group. So again, there was a combination vitamin E and vitamin C group, vitamin E only, vitamin C only, and then a placebo control. So just looking at the vitamin C for now, they basically found that the number of cases or the risk of developing prostate cancer was pretty much the same in the placebo group versus the vitamin C group. So when they actually did a clinical trial where people were actively taking vitamin C, and I'm sorry, I can't remember how much was it, vitamin C, 500 milligrams per day. So kind of just a typical amount that somebody would take. It did not have any effect on their kind of risk of prostate cancer. So people in the supplementation group and people in the placebo group developed cancer at the same rate, basically, prostate cancer. So to kind of look at all these studies, really there's no association between vitamin C and prostate cancer risk. So again, if you have a male client that's interested in taking vitamin C to lower their risk of prostate cancer, at this stage I would say it's not worth it. So limitations of the studies, this is always important to assess because every study has limitations, but really importantly, the effect of smoking wasn't assessed in all of these studies, and smoking, can lead to kind of massive free radical damage, so that's definitely a problem. Food frequency questionnaires, again, aren't great. Some of the studies, though, did measure plasma ascorbate levels, so they could kind of get around the whole like self-reported dietary intake. And I do have to say that clinical trial that lasted for 10 years was pretty impressive. Running a clinical trial for even longer than 6 months is tricky, so I can't imagine having to do it for like 10 years. So why is it difficult to test the effects of vitamin C on cold prevention? And then also, why would it be more difficult to test the effect of vitamin C on cancer risk? Kind of the answer to both these questions is just that there's so many variables involved. Vitamin C is like really obviously tightly correlated to your ability to kind of acquire fruits and vegetables or supplements, however you want to take it. But then, that's all tied into access and socioeconomic status and all these different issues. And also, it's tricky because like if you're somebody that already eats a lot of fruits and vegetables, you probably are a bit more health conscious. And then if you do that, you're probably also somebody that exercises a little bit or at least tries to like move around a bit more, probably less likely to smoke, that type of thing. So, a lot of these studies did try to like kind of measure all these co-founders, but it's really tricky. And then cancer is super tricky because you don't know. Most of these studies just said like, well, what'd you eat in the past 10 years? And we're hoping that it's your last 10 years of diet intake, which affected your risk of breast cancer. But who knows? It could have started, at birth or even in utero. So they're all very, very difficult questions to answer. Another major thing that I've seen vitamin C marketed towards is cardiovascular disease prevention. I don't know if any of you have seen these bottles of pills, but vitamin C in foods, it's been shown in these kind of massive epidemiological studies that people have decreased cardiovascular disease risk when they have increased fruit and vegetable intake and then higher plasma concentrations of ascorbate. So that's not that surprising. People that tend to eat healthier have lower risk. And more specifically, they've also shown people that have kind of low vitamin C, lower plasma ascorbate is related to higher levels of the bad cholesterol, LDL cholesterol, and then also high vitamin C status, high levels of ascorbate are related to elevated levels of the good cholesterol, HDL cholesterol. So nothing too surprising there. Quickly though, since again, I don't know if you've taken that pathophysiology course, why do we consider LDL to be bad cholesterol? What does it do that's so bad? So since I'm sitting in a room by myself, I'll just answer this. The reason that LDL is considered bad is because it basically transports cholesterol. So remember, HDL and LDL are not cholesterol themselves, they're just transporters. LDL transports cholesterol from the gut and deposits it into, it kind of delivers it, I should say, to different organs. HDL, on the other hand, takes cholesterol from your body and brings it kind of back to the liver so it can get rid of cholesterol. So that's why HDL is considered good. So can vitamin C help prevent cardiovascular disease? So I'm looking at a bunch of different supplementation studies. So a lot of them were epi studies. They looked at kind of older 50 to 75-year-old men and women who were supplementing with anywhere from 200 to 1,000 milligrams per day of vitamin C for 10 years. And then they found in a lot of these studies that basically it had no effect on cardiovascular disease risk or mortality. And again, I think it's such a hard question to answer. There's so many different variables involved. So who knows if that's actually true, but in these large scale studies, they haven't shown anything with like, if you're trying to consume higher amounts of vitamin C, will it lower your risk of getting a heart attack? These studies show that probably not. So one of the mechanisms, because, there's still some data out there saying that it can, just in general, if you consume higher fruits and vegetables and have higher or, better status of vitamin C or just like adequate status, I should say, that you may have lower risk. Some of the mechanisms of how vitamin C can protect against CVD, so there's kind of two major ones. One is it may help decrease monocyte adhesion, which is the first step of atherogenesis. And let me just step back for a second because, again, for those of you that haven't taken pathophysiology recently, I just want to go through what atherogenesis is and basically the steps of that, or else you wouldn't be able to understand kind of the next couple slides. So remember, atherogenesis is basically making one of these big atheromas, or this big kind of bulge on the side of an artery. And then the very first initiating step to kind of getting these kind of like plaques in your arteries is actually having higher blood pressure. So we always hear like having high blood pressure is really bad for you. But why is it bad for you? This is one question I kind of love to ask. And again, I really wish I was teaching this in person. Hopefully by next year I will be. But yeah, why is high blood pressure bad for you? So it's almost a little counterintuitive. A lot of people, even though we've heard that kind of all our lives, it's something that you probably know by the time you're like 10 years old. High blood pressure is bad for you because it makes blood kind of constricts your vessels, and it basically, or because of the constricting vessels and higher pressure, all of the stuff in your blood, all the little particles and compounds are kind of traveling through there at a much faster pace and in kind of a more confined area. So they're way more likely. It's kind of like cars traveling through like a tunnel or something. If you're traveling faster, you're way more likely to get into an accident when there's a ton of cars around you. So then you end up kind of like scraping against the tunnel or getting into an accident. Or you can kind of see it as, yeah, these particles kind of literally scraping the sides of your arteries. And when you get that little scrape or nick, oxidized LDL is way more likely to stick to that part. So basically, where that little like injury occurred. So oxidized LDL comes over, sticks to it. The body then responds by recruiting monocytes or macrophages to come over and try to eat up, because remember, macrophages are those things that basically engulf or eat up things. They try to eat up that oxidized LDL. So that's what they're showing you here. Unfortunately, that doesn't usually work. And then they become these like bloated foam cells and end up just sticking themselves to the artery. I'm not quite sure why we haven't evolved past this, but for some reason, this is what always seems to happen. And then a whole bunch of these kind of form. Eventually, it kind of forms this lump, and then we get, it actually kind of mineralizes as well. So it becomes this kind of like hardened plaque on our arteries. So, kind of back to what vitamin C does, it may help decrease monocyte adhesion. So, after they kind of engulfed or ate up all those oxidized LDLs, vitamin C may help them to not stick there. So, potentially they can kind of leave after that. Another thing that vitamin C does is decrease LDL oxidation. So, LDLs can become oxidized in circulation. So if vitamin C kind of prevents that, it's going to stop that whole first process of the oxidized LDL sticking to that little scratch on the artery. In general, though, I am not convinced that taking vitamin C supplements helps to lower heart disease. So that's another one that if you have a client that's asking, should I take it to lower heart disease? I don't think the science is there yet. I'd say no. One thing that vitamin C actually might work for, it's kind of been a depressing with colds and cancer and cardiovascular disease. Not much has been shown for higher intakes of vitamin C. But with cataracts, it may actually work. So a bit of background, remember, cataracts, it's a number one cause of blindness in the elderly. And all a cataract is oxidative damage to the protein of the lens of the eye. So basically, it's pretty much just these oxyradicals attacking the lens of the eye, and that's what results in this cloudiness. So vitamin C may help prevent cataracts. It's been shown basically in all these different observation studies that it can actually help lower the incidence. What it does is that if somebody in their kind of elderly people take it regularly, so let's say 500 milligrams per day, I believe it was, it can kind of slow the progression a little bit. It definitely won't help treat it from what I saw, but it can help prevent it. So once you already have cataracts, it may kind of like stop it in place so it won't get worse, but it's not going to make it get better. And then if you take regular vitamin C as an elderly person, you may help yourself kind of lower your chances of starting to develop cataracts. So I'd probably recommend it if elderly patients are interested in taking it. I'd say it can't hurt, but I would not take really high amounts. Like even if you can find like a 200 milligram pill, because I believe there were some studies with that as well that showed some benefits. Moving on to the interaction effects. So I do try to discuss these when I can, just because there's a bunch of different interactions between the nutrients. So vitamin C can actually help iron to be absorbed. And you've probably heard of this before. We're going to talk about this a lot, obviously, in the iron section. But non-heme iron, so that's kind of the vegetarian source or what you'd get, iron from broccoli or something. Vitamin C can help increase the absorption of non-heme iron And it does this by converting the iron in the gut lumen from the 3 plus state to the 2 plus state. When the iron's in the 2 plus state, it basically can help kind of stick on to its transporter better. But again, we're definitely going to talk about this more. And this is kind of the thing that you might have heard of or have done before is, when people like squeeze a bit of lemon juice onto broccoli and say that it improves iron absorption. Yeah, it might, because, you get vitamin C from the citrus. And then, it might help basically the iron become a more available form to be absorbed. Vitamin C also interacts with copper, as we kind of talked about before. With it seems like they just don't get along. Like copper cookware is not good for vitamin C, but at the same time, vitamin C can decrease copper absorption as well. So basically, copper needs to bind on, or there's this thing called metallothionein that helps copper be absorbed. Kind of see it as like a transporter, basically. And vitamin C, if copper and vitamin C are in the gut lumen at the same time, the vitamin C will prevent copper from kind of attaching on to its transporter. And this is generally seen when you're taking really high amounts of vitamin C. So it doesn't occur so much when you have, like, I don't know, just whatever a normal food amount of vitamin C is and then some copper in there. But if you're taking really high amounts, so say if you just like had a meal and then you down 3 of those like 500 milligram pills, if you do that regularly, it has been shown that after 2 months of doing that, you will actually decrease your copper body stores. So just another reason not to take really high amounts of vitamin C, because it can actually interrupt the absorption of other nutrients. So looking at excretion, just to kind of tell you a pattern straight up here, is that most of the water-soluble vitamins are excreted by the urine. So not a surprise. You're mainly getting rid of these through your kidney. However, our body, so basically remember the kidneys are just like constantly filtering your blood, right? I can't remember exactly how much it is, but I think it's like liters per hour or something like that. I have it in the water slides, I think, the actual amount that it's filtering. And so remember I was saying that, even if you take in a ton of vitamin C, like 3 tablets or whatever you want to do, the first thing your body will do is it won't let the extra vitamin C in. So it'll kind of just stay in your gut lumen and your gut, and eventually you'll just excrete it. But if the vitamin C does manage to get into your bloodstream, so past the enterocyte, your body will just really quickly kick it out. So usually within about 30 minutes, it will get rid of all that extra vitamin C because it doesn't need it. It can only store so much. It only needs so much. The body can recycle vitamin C, so it doesn't need to be like inundated with all this vitamin C. So when you're taking low to moderate amounts, so just typical amounts of vitamin C intake, so no supplements, the kidney reabsorbs a lot of that. And then the actual carrier is that basically the SVCT1 that we saw before at the level of the enterocyte. However, at high intakes, those transporters, those carriers become oversaturated, and then they can no longer reabsorb vitamin C. So all the excess vitamin C will be excreted. So basically you're just like bombarding these things. They can only kind of like let back in a certain amount of vitamin C back into the body. There's just not enough room for them to all come back in. Those doors are closed basically. So then your body just excretes all that extra vitamin C into your urine. So you might have heard that Americans have the most expensive urine in the world because basically we're like spending all this money on all these supplements and then like peeing them out 30 minutes later. So it is kind of silly. Looking a bit more closely at excretion and kind of how it's tied to toxicity. One thing I do want to point out is that when you're excreting vitamin C, so at the level of the kidney, you first convert the vitamin C or ascorbate into dehydroascorbate. So remember, that's like the used up form where it's already given away its electrons. Then vitamin C, the ring structure of that is opened, of the dehydroascorbate. And one of the things I want you to pay attention to is this then breaks down into a bunch of different metabolites. But the one I want you to look at carefully and remember is oxalic acid. So when your kidney breaks down vitamin C, one of the compounds that is produced is oxalic acid. Um, and if you take in high amounts of or vitamin C, then you get tons of oxalic acid in your kidneys. And for people that are kind of regularly taking supplements over the course of about 10 years or so, it's a little dangerous because oxalic acid is key in the formation of kidney stones. So, with too much vitamin C intake over years, and usually this only occurs like 10, 20 years down the line, but it can result in kidney stone formation. So, yeah, taking in really high amounts of vitamin C puts you at risk for kidney stones, which I hear are extremely painful. I've never had them before. But yeah, so another reason not to kind of overdose on vitamin C. I just want to point out too for the exams, I'm never going to have you draw structures of things. You know, it's not a biochemistry class. I'm kind of teaching this course because I want you to be able to apply this stuff in your clinical practice. So I'm trying to make it as useful as possible, but I'm never going to ask you to draw this out. Like, the only thing I really want you to remember from this slide is that oxalic acid is a byproduct of vitamin C degradation, and oxalic acid is a key component in the formation of kidney stones. So that's why high intakes of vitamin C can cause kidney stones, chronic intakes. So I touched on this a little bit in our last lecture. What stimulates the excretion of vitamin C since we can recycle it? Why does the body get rid of it when it can just constantly renew it? So I wasn't able to find anything, why does this occur? Why do we finally break it down and get rid of it? I tried to find, is it the number of times it's had its reactions? Or maybe is it just the time it's been in a cell? I'm not sure. I could not find an answer to that. But yeah, so sorry again. I still don't know why. And then again, here's just that flow chart for basically what happens in mammalian tissues. And the main thing, again, it's spontaneously degraded to oxalate or oxalic acid. So DRIs for vitamin C, as we know, I mentioned it before, it's an RDA in milligrams per day. So on the exam, I would like you to know the RDAs for males and females. So what those are, I want you to know if it's an RDA or an AI, because sometimes it's an AI. I want you to know the units, milligrams per day, micrograms, whatever it is, and then the actual numbers for the exams. And I know you're not going to have these memorized for the rest of your life, and they change slightly every 10 years or something, but it's good to have a concept of kind of where they are. Sometimes it's 2,000, sometimes it's 0.1 milligrams or something. So I just want you to have kind of an idea of what type of levels of intake you need for each of these. So just remember for this one, it's always just adult males, adult females. So for males, again, 90 milligrams per day. For females, 75. And then the rationale that for all these recommended intakes, and if you're really interested in this, all the DRI books are online. This is basically, made by the NIH, and they go through all the studies of how they came up with those numbers. And a lot of them are based on balance studies, so basically how much they give people and how much the body decides to excrete and how much is saved. So they found that if you're taking in this much, the body excretes very little and kind of uses it. One thing that has been noted is that smokers do need a bit more vitamin C, so they need an extra 35 milligrams per day because smoking accelerates the depletion of the vitamin C pool. So you don't need to memorize that, but it is interesting. So I just want to finish off by talking about vitamin C megadosing. Again, vitamin C is a really popular vitamin. There's tons and tons of bottles of vitamin C. It's really interesting. You can totally gauge the popularity of the different nutrients by how big of a section they have at the pharmacies or whatever. Vitamin C section is really massive. And vitamin C megadose is actually anything above the DRI guidelines, just as a definition. I don't know exactly how vitamin C got so popular, but I think it's because of Linus Pauling, who was this Nobel Prize winning chemist or physicist. I can't remember what he originally did. I think it was chemistry. And he kind of retired, and in his older age, he got really obsessed with vitamin C. And he kind of thought that he got really obsessed with like prehistoric diets, and he started thinking like, well, like thousands of years ago, we definitely would eat meat when we could find or like basically hunt down an animal. But for the most part, we're probably eating like tons and tons of like leaves and plants and berries and stuff like that. But really, like a lot of like roughage, like a lot of leaves. So he thought that, yeah, if we were consuming that much plant matter, we probably had like really high intakes of vitamin C. Because as you know, vitamin C is in fruits and vegetables. So there's been like all these studies of people that are kind of obsessed with prehistoric diets. One thing I just wanted to point out is like when I was doing my PhD, we were working with this guy, Dr. Jenkins, at the University of Toronto, and he was studying this thing called the portfolio diet, where he would make people eat 5.5 kilograms of plant products per day, which is crazy. That's like, I think, 12 pounds or something of plant products. I remember people sitting there. At one point, he had people eat 6 heads of romaine lettuce. So, really, like, can you imagine the amount of time? People just sit there for hours just eating salads, basically, with nothing on them. And he was interested in seeing, like, if we were, potentially if, like, cavemen or whatever were eating this, did it have any health benefit to eat this much, like, leaves and vegetable matter? So again, I think it all comes from that, but it's all based on the diets of closely related apes. That's what they think, or of prehistoric humans. So the Linus Pauling Institute, you can go ahead and look at this online. They believe, from what I last saw, that, if a typical human eats about 2,500 calories per day, our actual needs of vitamin C should be 2,300 milligrams per day. And this is based on basically what he thought we would be eating because of the amount of plant matter we'd be eating or something. In all honesty, I don't know where this number came from. I think it's just probably a random guess, but he is a pretty popular scientist still, even though he's no longer alive. The Linus Pauling Institute has all these different things about nutrients, and a lot of them are not based in science. It's kind of sad, considering he was like a Nobel Prize winning chemist or something. I don't know why he kind of went off the deep end in his older age, but I think he's the main reason that people are so obsessed with vitamin C. I think he started all this in like the 70s or something. So yeah, then when I saw this crazy number, because remember, we're supposed to be taking in 75 to 90 milligrams per day, not over 2,000. So then I was like, well, what's the craziest thing I could find on the internet for like vitamin C? So there's this Vitamin C Foundation, and they actually recommend people take in 8,000 milligrams of vitamin C every 20 to 30 minutes. So, obviously as scientists or people in health, we know that that's ridiculous. But I just want to point out that your clients, people that you're counseling or whatever, a lot of them just rely on the internet for this type of information. And there's like vitamin C is popular. So people may stumble upon this and think that it's correct. And just be aware that, yeah, there's some pretty crazy stuff out there. So no studies that I could tell, or very few studies, have really looked at whether or not vitamin C megadoses are effective. And that's when people are consuming like thousands of milligrams of vitamin C. And I think the reason for this is because there are like a few studies that show that it doesn't work for cancer, cardiovascular disease, or colds. But I think, it's kind of unethical to have people consume such large amounts, knowing that it can lead to kidney stones, and then I'll show you in a second, also diarrhea. So that's probably why scientists like hesitate to do these studies in the first place. Just, yeah, it's unethical and it can hurt people. Does vitamin C absorption increase with stress or disease? This is just a question I get a lot. I haven't found any evidence to show that absorption will increase when people have like cancer or CVD or diabetes. So, yeah, haven't seen anything there. In general, if you're taking like a capsule or like a tablet of vitamin C, again, remember that the plasma concentrations are very tightly controlled. So any kind of oral intake of vitamin C, your body will not let in a ton of it. And then if for some reason you manage to get it into your bloodstream, your body will get rid of it immediately. And that's basically what happens for all nutrients. Your body only wants a certain small amount of the nutrients per day. if you bombard it with tons of nutrients because you think it will, I don't know, fortify your body or whatever reason you're doing it, you're just going to pee it out or you're just going to excrete it pretty much immediately. The only way that you can kind of, taking in tons of supplements, usually your body just won't let it in. But some people are kind of a little nutty, and you can actually buy like vitamin C injections or like stuff to inject on like even like Amazon. I think somebody in my last time I taught this found this online. So some people are so crazy about vitamin C that they'll actually like just inject it into their veins. But again, it will be excreted very quickly, but super dangerous. So the main deficiency state of vitamin C is scurvy, which we've already talked about. Remember, that's from impaired hydroxyproline. So that's the whole from your collagen synthesis slides. So really impaired collagen formation is what is leading to these kind of like spongy gums that can no longer hold your teeth. Also, the other major things you're going to see beyond just the teeth is this kind of bruising that you see all over. And then, of course, any type of malnutrition can lead to death if it's untreated. One thing to point out, and I'll mention this over and over again, it takes our bodies a while to see deficiency. So even if you stop eating any fruits and vegetables, it'd probably take a good couple months. You know, our bodies store this. Water-soluble vitamins aren't stored for as long as fat-soluble vitamins, but we do have a sufficient storage, and your body will probably recycle it more too if it notices nothing else coming in. So you're not going to develop scurvy in like 2 weeks or something. It would take like 6 months to a year to see any of these symptoms. Looking at toxicity now, so how much is too much? So normal intake again, 75 to 90. The TUL, tolerable upper limit of intake, is set at 2,000. And you'll notice with the water-soluble vitamins, the TUL is much higher than for fat-soluble vitamins. We can get rid of the water-soluble vitamins really easily just in our urine, whereas fat-soluble, they're a bit more toxic. So you'll notice that the TULs are much lower for those. But the TUL, again, set high because we just kind of excrete vitamin C if we're getting in too much. But you can kind of toxify your body if you do something pretty dumb, like take tons and tons of it kind of in rapid succession. So if you take 10 pills in 1 hour, your body's just not going to let anything in. However, if you take 10 pills, 1 per hour over the course of 10 hours, your body's going to let a bit more in. So, you know, different ways to go about it. But overall, you know, just even 1 glass of orange juice every day is fine. So you don't need to be taking in any supplements if you're a healthy person. Toxicity symptoms, 2 major things happen. 1, kidney stones. So we talked about that, and that's because of oxalic acid. And the second one is osmotic diarrhea. So osmotic diarrhea occurs when the vitamin C pills basically are not digested. They sit in your gut lumen. And then what happens when they're kind of sitting there waiting to be excreted is that bacteria come over and kind of start eating them up basically, and then they release gases. So basically they sit in your intestine for a bit, and it causes you to become kind of extremely bloated, and osmotic diarrhea can also occur because of that. So yeah, 2 major toxicity effects of too much vitamin C: kidney stones and diarrhea, and bloating, I guess. So at the end of every lecture, I like to go over just a really quick review of the different, kind of the major things for each vitamin. So food, function, deficiency, toxicity. And the reason I do that is because we're going to go through a lot of these nutrients. I think we go over like 30 of them or something by the end of the class. And I know it's really hard to kind of keep all of these together in your mind. Like for water soluble, I think there are, I always forget, I think there's like 8 or 9. So having this type of table is nice to kind of keep everything straight in your brain. A lot of people do study for this class by making their own like very big table. So you can kind of do that too if that helps you. Oh, whoops. So it seems a little silly for me to do this by myself, but what are the food sources of vitamin C? Try to remember that. You probably already know it. Citrus, fruits, and vegetables. What are the functions that we discussed? So the first one was that kind of building function, hydroxylation reactions. What else does it do? Antioxidant, something you knew before the class. Anything else? Why do people supplement with it? For colds, cancer, CVD, etc. What's the main deficiency disease? Scurvy. And what are the two major toxic effects of taking in too much? Diarrhea and kidney stones. Great. So the next lecture, we're going to move on to the B vitamins, and it will pretty much be the B vitamins from here on out. And yeah, have a great rest of your day, and thanks so much for listening.